welcome to Cancer Pathways lecture series. I'm Michelle Massey, and today we are going to be talking about stress management, COVID-19, and cancer. And I'm a clinical oncology social worker at Cancer Pathways, and I also manage the lecture series and lead a bunch of support groups, so I will talk more about that at the end. But the style that I prefer with these presentations is I'm going to show you some research that has been done. And the research that I'm using today is from the Journal of Psychosocial Oncology, the American Cancer Society, and the National Institute of Health, and the CDC, of course, too. So that's where all the research that I'm going to show is from. And so I'm going to present some information, and I'm going to share my own experience. I've been an oncology social worker for almost 20 years and show kind of what I'm seeing in the community right now. And then definitely I want to open it up for a conversation and questions. I have a few people who have emailed me questions. They just get shy, or I don't know, they just might not want to ask in person. So I'm happy to read those questions too. So, let's see, share the screen. All right. Okay, so here's what we're going to cover in a nutshell. Now, all of these topics could be their own presentation, so I am aware of that. So we're going to kind of skim over some of it, but I'm going to say enough to relate it to stress management. But if you have questions or you want to know more about a specific topic, just email me, or we can chat another time, or you know, you can feel free to ask questions. But I do have the understanding that definitely these topics could be their own. They could be their own hour. So we're going to discuss some of the mental health needs of cancer patients, COVID-19 and stress, chronic and traumatic stress, stress management, the grief response, healthy coping mechanisms, dialectical behavioral therapy, and definitely time for questions and conversation. That's my favorite part. So I might be singing to the choir here, preaching to the choir, that mental health needs of cancer patients. I thought this was an interesting image from the National Cancer Institute. Common thoughts of cancer patients is, will cancer come back? Will I be able to go to work? How will I take care of my family? How will I pay for these medical bills? How is this affecting my marriage or relationship? And research from the Journal of Psychosocial Oncology, it just came out in June of 2020, reports that distress is 43% of the oncology population. And we all kind of know statistics anyways, often they're a little low. So in my experience working with cancer patients, I would estimate this to be most people feel distress with cancer. So just throwing that out there. But this is what the Journal of Psychosocial Oncology found in their research. And PTSD occurred between 27 and 35% of the population. So there's natural anxiety about the future, treatment, family dynamics, finances, work, everything. And feelings of hopelessness and depression increases with living with chronic illness or a cancer diagnosis. Anticipatory grief, or really fear of the unknown, or just being uncomfortable with the unknown is common with cancer patients. So COVID-19 anxiety and stress. Now, COVID-19 anxiety is a little different than regular run-of-the-mill anxiety. So anxiety in general is the overestimation of danger with an underestimation with our ability to cope. So if we think an event is so horrible that there's no way we can get through that, and there's no way we will be able to cope with that, then our anxiety shoots through the roof. So I can understand that. So right now with COVID-19, nothing to do with cancer, but with COVID, according to the National Institute of Health, about 1/3 of our population right now in the United States has diagnosable anxiety and depression. That's a lot of people. That's 1/3 of the population. And in June, this is again from the National Institute of Health, suicide crisis line calls increased by 8 times in the month of June. So there's an increase in anxiety disorders because of COVID-19, with the uncertainty of the world, the visual reminders like masks. You go outside and everyone's wearing a mask, or you see the 6 feet apart stickers, or numerous bottles of hand sanitizer everywhere. And so there's all these visual reminders that there's a pandemic, that there's a cause for fear. And the brain registers that as, hey, there's something to be nervous or scared about. Increase in anxiety disorders is a result of isolation, especially if somebody lives alone. This is particularly challenging. And routines are disrupted. You know, we feel safest when we have a routine, when we have something that we can count on. And our brain really likes routine and something you do relatively at the same time every day. It makes us feel safe. We know what to expect. When that is disrupted, typically anxiety increases. So the unintended consequence of social distancing, and this relates specifically to COVID-19 and anxiety. The message of increased risk, you know, like I just mentioned, like the mask, the hand sanitizer, and it triggers people. So if you're out and about and you see all these masks, it increases anxiety. Although there's reasons for the mask, and we should wear masks, so there's valid reason for it. But whether there's a reason for it or not, it still increases anxiety. So anxiety disorders are triggered. So people who had an anxiety disorder before COVID are now triggered repeatedly, and now their anxiety is through the roof. So that's kind of the unintended consequence. Although needed, you know, we need to wear masks, we need to social distance, but it's still an unintended consequence for anxiety. So stress is not created equal. So COVID-19 stress in particular is not distributed equally because it's particularly difficult for those who had mental illness or at least significant stress before COVID, before the pandemic. And it's a higher stress with people who are at higher risk with compromised immune systems. So of course, that makes sense. In a pandemic, you know, feels fair that anybody with a compromised immune system would have additional stress and additional anxiety or depression. So people who had limited emotional, practical, and financial support possibly most likely have more limited, at least emotional and practical support. And those who maybe did not have financial limitations before now do. And of course, those who had already had limited access to healthcare. And now trying to even, you know, get a doctor's appointment, it's all telehealth mostly. And, you know, if people don't have access in order to get telehealth, that increases stress, absolutely, because of COVID-19. So chronic and traumatic stress, we really can't talk about something like a pandemic without talking about chronic and traumatic stress. So everybody's experienced just run-of-the-mill ordinary stress. Stress is part of life. So, you know, you can't get rid of stress 100%. But chronic stress happens when daily life becomes debilitating for an extended period of time. So while usually people just have, you know, regular stress, chronic stress is something like cancer treatment for 2 years. There's a 2-year time period. It's a long time period. This is an example. And so stress doesn't go away in that time period. That's an example. So chronic stress is a little different than not chronic stress because it triggers inflammation, insomnia, fatigue, headaches, insomnia, and a variety of physical symptoms. Now, regular stress can trigger those as well, but most often than not, chronic stress triggers all of these. So traumatic stress happens when there's an event that overwhelms our capacity to cope. Now, that could be a death of a loved one that you're very close to. That could be a natural disaster like a hurricane. So traumatic stress it adds a significantly more challenging way to process the stress. So the result of COVID-19 is chronic stress has become normal now, and traumatic stress has significantly increased. So what's normal now is feeling stressed out because we don't know when COVID-19 will end, and it's causing this long-term stress response. And grief and loss. And we really can't talk about the response to COVID-19 without looking at it from a grief and loss perspective. So standard grieving may feel like emptiness, anger, sadness, physical reactions, nightmares, or insomnia. That's the typical, grief and loss after a loved one passes away, or it could be a divorce, or there's many grief situations that happen in normal life, and it's usually time limited. Usually there's a standard grief process for 6 months or so, but and often it can go longer than that. But that's kind of the standard grief response. So you add COVID-19 into people who are already grieving, and I know cancer has a lot of grief, right? You grieve your identity, things are different. You might grieve the loss of a job, right? So there's a lot of grief components to cancer, but when you add COVID-19, it's now changed loss of a routine, because people are not working like they were. They can't even go to the grocery store without a mask. Or some people with compromised immune systems can't do that at all. Loss or change in friendships and relationships because of COVID. So that is pretty significant with social function. Loss of job or workplace complications, where now you might be expected to work from home. And that is a tremendous loss if you're losing the interaction with your coworkers. But it can also add other complications because working from home might not be ideal. And the biggest thing about COVID-19 is a loss of security or feeling safe to go to treatment for cancer patients. So understandably so, if someone has a compromised immune system, it would be scary to go to a medical facility. So that's perfectly reasonable. But it's a loss of security, and that's a particular challenge. Now, I always say, follow whatever the CDC recommends, like wear your mask, do social distancing, follow what they say. But there is a reason why we have to acknowledge that there is a grief process with it. But I'm not complaining about the CDC. I want to be clear on that. So complicated and traumatic grief. So a pandemic can prolong or disrupt the normal grieving process. And we talked a little bit about that with grief. So it's compounded by sorrow, anger, fear, and anxiety above and beyond the normal grief process. So you might have grief about having cancer and, losing. It could be a number of things that we just mentioned, like your identity or ability to go to the doctor. But now with complicated or traumatic grief, it's compounded in addition with more, could be probably fear, anxiety, anger, a feeling of deep loneliness and anger, nightmares, inability to maintain daily activities, inability to concentrate, a popular one that I see right now, and inability to experience joy. There's a loss of sense and safety and security in the community, obviously, because we're in a pandemic. So it's not like these feelings are wrong. You're not wrong for feeling this, right? It's normal to feel heightened anxiety during a pandemic. That feels fair. The grieving process is paused because the stress of COVID-19 takes priority. So a lot of the cancer patients I work with describe kind of how their identity has changed, that now they're living with cancer. And what does that mean for them or their families, for their work? Everything has kind of changed. But the grieving process of that is paused because now they have to figure out, when can I go to treatment? Can I go to treatment? when, and do I have a mask, and is there hand sanitizer? So there's all these concerns about COVID that are kind of taking up that space that normally would be given to a standard grieving process. So the ongoing grief process slows progress towards getting back to a normal routine, which increases anxiety. Well, that's kind of the gist of what's happening. So then we need to bring in stress management, because this all increases stress. And I understand, I'm not saying anything nobody doesn't already know or already experience. So. But with stress management, I'd like to propose that you think about stress not in terms of it being cured. Stress is most likely in anyone's life is never going to be 100% gone. So think less in terms about curing an irrational fear and more about stress management. So the training with anxiety with cognitive behavioral therapy or dialectical behavioral therapy is that to treat anxiety, we are treating an irrational fear. That someone is fear, it could be of anything. Remember, it's an overestimation of danger with an underestimation of our ability to cope. That's more with an irrational fear, or maybe somebody's catastrophizing something. But with COVID, it's a little different with stress management. So the first thing I'd like you to think about is that you actually don't have to feel 100% safe to manage stress. So the goal is moved away from clear your life of all stress down to 0%, to more like managing stress. So I think of like, I was not that long ago on an airplane, and I was thinking, I feel like it'd be a super stressful job to be a pilot. Like, this pilot has to fly the plane, land the plane, and make sure everyone's safe. That feels super stressful. For me, it does. But that's a good example. Like, that job is a stressful job, but pilots every day manage it to do it well and do it safely. So like a police officer, a firefighter, like very stressful jobs, but they manage it. So it is possible to have a happy life, find joy and fulfillment without feeling 100% safe. So that, I encourage everybody to sit with that. This trouble with COVID, though, is that the fear is not unfounded, right? Like, the fear of going out and being in the community with all the masks, the hand sanitizer, that is a fear. That is a rational fear. That's not an irrational fear. So as providers, we're not treating it the same, and we need to at least acknowledge to people that you might have some irrational for how far you take it. That's up to the individual situation. But in general, looking out at people and everyone's wearing masks, it's completely normal to have fear. But notice the level of preoccupation with fear and if it's functionally debilitating. So is your fear does it match the situation? Is it actually debilitating you? Now, if you have a compromised immune system, totally understand. I understand definitely you might not want to go out into public, but maybe you're, post-cancer treatment or in a different place in your life, and maybe going to the store safely is okay, or at least standing at your front door and having your friends come over and being more than 6 feet away. Maybe that is safe. So recognize the actual danger versus perceived danger with less preoccupation with improbable risks. Careful of the yeah buts, I call them. So I think, oh, if I'm going to go to the store, yeah, but this, yeah, but that. Or if I have a friend park in their car in the driveway and just sit there and talk to me more than 6 feet apart, think about how realistic your fear is and watch the yeah buts. If you have children, you will know exactly what I'm talking about with the yeah buts. So when you free yourself of over thoughts about improbable risks, that allows you to be focused on reality. What are the real probability risk factors, and how can you still experience joy while being safe, but keep the preoccupation based in reality. And that's managing stress, because we already determined, yes, it's stressful, and it gets to be stressful because it's a pandemic. So, okay, cool. So now we just need to figure out how to manage that. So now what? I've talked all doom and gloom. So we're going to go over different sections of self-care and healthy coping. So the first part is about self-care, and we're going to go over different parts. But definitely, I'd like you guys, if you are experiencing high anxiety and stress, managing stress would be to limit your exposure that triggers anxiety. Be informed, but set limits for watching the news. Now, I'm serious. I recommend to people, don't watch the news more than twice a day. Just check in. If you find yourself watching the news over and over again for hours, it's possibly triggering you and increasing your anxiety, and that's not necessary. You don't need to do that. Because remember, we're managing stress right now. So get your information from reliable media sources like the Center for Disease Control. Really focus on that. What are, science-based reliable sources? No. We all enjoy Facebook, but I don't know that I would say that's always the most reliable source. So stick to the professionals. They are good at their jobs. Let them do that. So check in with reliable media sources. Self-care for managing stress, create a routine. The brain loves a routine. That's where we feel safe, is when we have a routine. I don't mean schedule. Schedule is different. So it doesn't necessarily matter what time you do everything at, as long as it's in some kind of a routine every day. So medication management. Now is the time, if you have increased anxiety and depression and you're open to it, to at least discuss it with your doctor. If you want to try an antidepressant or an anti-anxiety medication, if you're really suffering and you feel this could help, now is the time to try it. And I was talking to one of the dear people I work with, and they said, well, I'm going to try it later. I'm like, honey, later is now. Later is right now. You're in a pandemic with cancer. So let's not hope it gets worse. So I think later is today. So it's almost like permission, like and any kind of medication you feel would help, whether it's naturopathic care, that's great, or standard care, whatever it is that I hope this can take away a stigma of medication for anxiety and depression. Choose healthy habits. So exercise, what you can, nutrition, try to eat healthy. I'm not going to talk about the negative habits, because obviously, like don't do drugs, don't do things that would hurt your body. So blanket statement, no unhealthy habits. So choose healthy habits, and you all know what they are, and get enough sleep and that kind of thing. Mindfulness is wonderful with meditation or breathing. That's always a healthy habit. And check your thoughts. Like, are your thoughts realistic? As we do want to give credit to feeling anxious during a pandemic. Remember, that's fair. So check your thoughts. Here's permission. We're still checking our thoughts. So it's perfectly reasonable to have increased anxiety during a pandemic. So say it with me. It's perfectly reasonable to have increased anxiety during a pandemic. One more time. It is perfectly reasonable to have increased anxiety during a pandemic. Absolutely. There's nothing abnormal about increased anxiety and depression too during a pandemic. So healthy coping is distraction. That's traditional cognitive behavioral therapy. Distraction, especially if you're feeling panic kind of rise and rise and rise and rise in that anxiety. So reading, working, go for a walk, spending time in nature, artwork, drive, any of the mindfulness-based relaxation techniques like deep breathing, meditation, visualization, anything that you can do to distract your brain enough to do some deep breathing and find that sense of calm and peace to really impede a panic attack. And family and friends. Family and friends would be, I think, one of the most important ways to manage stress or to have healthy coping would be to engage with family and friends. So social support. Social support is, this is my opinion here, I believe that one of the most important ways to manage stress, to have healthy coping, is social support. That we are human beings. Human beings are, we thrive on connection with others. And having social support means having a safe place to share worries and concerns while feeling accepted, understood, and connected. That's the whole package that goes well. So you're able to say, yeah, I am scared. And then you're with other people who are like, yeah, I understand that. Yeah, you get to be scared. You get to be worried, and we will still love you. That's what social support does. So reduce isolation safely. So again, follow recommendations from CDC and do what's best for you. But get on those Zoom calls or talk to people, engage with people with social distancing. Seek help from a mental health professional or a therapist if you feel that's necessary. It's always, I think, all the support, the better. Join an online support group. They might be different than in-person groups, but they have a lot, there's a lot of joy, there's a lot of connection felt with online support groups. Set intention to leave your home once per day safely. And that could be walk out your front door. So that could be just, it doesn't have, you don't have to necessarily go very far, but at least go outside and see that the world is still happening. Social distance with a friend if it's safe. If it's safe for you to do so. I think that's very important. If you do have a compromised immune system, be clear about the risks you are willing to take when leaving your home, and set boundaries with friends and family. Friends and family who have not gone through cancer or chronic illness where their immune system is compromised, they may not understand, and they probably don't mean any harm. They just haven't experienced it. So they honestly might not know how it is. So just some education to friends and family, and set some boundaries of what you feel safe doing and not doing, and work around that. So if you're not safe meeting 6 feet apart, feel safe, have somebody just drive up and sit at the curb, have it be 50 feet apart or whatever works, for example. The other part of healthy coping that my personal opinion is extremely helpful is finding meaning. So if you think about what does meaning mean to you? Is it what is important to you, or who is important, or what is your value system? What do you hold with high regard? What do you think is important to spend your energy on? And what do you value most? So find purpose, meaning in your life, and that will lower anxiety, lower depression. Appreciate the present moment. Express gratitude each day. And I've had people say to me, how can I express gratitude each day when all this is going on? Well, I do think it's important to realize it's very stressful, of course, obviously, but it's also important to see what's going well, because there are a lot of things that are going well right now, and express gratitude each day. Maybe it's for a phone call that you got, or a relationship that you're in, or a friendship. It could be anything. Like, what are you grateful for today? Or maybe that the sun is out. I mean, what it does is it sets you up, your confidence level and your brain, for appreciating what is going well. So think about, how can you direct your energy to what is meaningful to you, and finding meaning and purpose? And how can you help? Like, is there anything you can do to help somebody else? Because that gives us meaning, that gives us purpose. And that will in turn reduce our anxiety as well. So how can you help family and friends, or how can family and friends help you? Depends on your situation. So if you have a family or a friend with cancer, I recommend ask your loved one what they want or what they're comfortable with. So they might not be comfortable with what you're comfortable with. So it's really good to communicate and find out, what their thoughts are, what their boundaries are. And then associate what do they need versus what do they want. So they might say, I don't need anything, but you say, okay, what do you want? So it could be practical help like groceries, prescriptions, anything. But with increased isolation, regular check-ins are appreciated, but I would say imperative to people who live alone, or people who are just in a coupled relationship, because sometimes that can be stressful when they're in quarantine together. And you can help by practicing compassionate listening. So compassionate listening is different than traditional listening. Usually with listening, not usually, but often with listening, it's more like you're just waiting for the other person to stop talking so then you can talk. So compassionate listening is listening with intent. So listen to what your loved one is saying, the words they're using, the tone of voice, and also listen to what they're not saying. Kind of try to pick up on that. And reflect back to them what your understanding is. And that's like, gosh, I can understand, like, I feel that way too, or does it feel like this? Because that's, I can relate to that, compassion. So send a card, offer to take family members on a drive. If your loved one has severe anxiety or depression, I would limit the sharing of your own fears, as it may increase their anxiety. Although I would share enough to normalize the situation that, yes, it is a pandemic and you're living with cancer with a pandemic. I'm scared too. It's okay to normalize that, but I wouldn't go on and on about your own fears if they already have super high anxiety or depression. So mindful awareness. There's two activities. There's a 5 senses activity and a cope ahead strategy. These are both dialectical behavioral therapy training. I've done the 5 senses for years. I was trying to think, the first time I learned this must have been almost 20 years ago. Like, I learned this pretty early on in my career. So we're going to go ahead and do this. So the 5 senses is, first of all, you take a deep breath, and it doesn't have to be super deep. Don't hurt yourself over it, but just take a regular deep breath in through your nose, out through your mouth. And that type of breath is definitely, I recommend doing that daily to just reduce anxiety anyway. So with the 5 senses, this reduces anxiety. So you look around and you find like 5 green things or 5 red things in the room. It doesn't matter what color, whatever color you want. So if you want to, go ahead and look. What are 5 red or blue or green or pink things that you can find in your room? Then listen for 4 different sounds. Be quiet for a second. It's really strange. It lets you hear things that you normally wouldn't. Touch 3 different things, like it could be your coffee or your teacup, or the table or your sweater. Smell 2 different things. That can be tricky. That can even be like your sweater, or like your hand sanitizer you just put on for the 10 millionth time, or whatever it is. And taste 1 thing. So I'm going to taste my tea. So you'll always want to have mints or gum or something around. And then we do another deep breath in through your nose and out through your mouth. Now, this is a distraction technique. So by the time you're done doing all of that, hopefully it has disrupted the either obsessive thoughts, recurring thoughts, or panic. Panic can kind of creep up like that. Do the deep breath, and by the time you're done looking around and doing all that, hopefully with deep breathing, it will lower it. So the cope ahead strategy is a visualization technique that I know I use for people who are afraid to social distance and afraid to leave their homes. But they are identified as people who it is safe if they wear a mask and social distance appropriately. They feel it is safe to leave their home. They're just afraid to. So with a cope ahead strategy, you visualize social distancing step by step. So you start by the deep breath. You visualize yourself putting your mask on, have your hand sanitizer, get in your car, you drive to the store, and think about, what is that like? What are the possible problems with that? You sit with that for a minute and then visualize, what would it be like to get out of the car, put your foot down on the ground, step out, shut the door, look at the store, walk in the door. Imagine the sound of the doors opening of the grocery store. And then what does that feel like? And is anxiety raising at that point? Because now you're walking into the store. And think about, okay, what could go wrong? Like what realistic barriers are there? And if there's not any realistic, barrier, because you have your hand sanitizer, you have your mask. And then visualize, put your hands on the cart, push your cart, go down the aisles, and start with even something like 3 minutes. Spend 3 minutes or 5 minutes in the store, and then you can take it further and further. Then you buy your product and then you pay for it, and, take it step by step though. So if somebody has really high anxiety, or you have high anxiety yourself, just visualize yourself driving to the store and stop there. Just stay with that thought first, and then you can build on it, as needed, as the anxiety allows you to. With a realistic viewpoint is that you're prepared, you have your hand sanitizer, you have your mask, and with the visualization of you completing these tasks, but step by step. Don't put too much pressure on yourself to go too fast on that. So those are two kind of mindfulness-based awareness activities that you can do, or CBT and DBT-based. So in conclusion, increased anxiety and depression during COVID-19 is completely reasonable. I should put completely in there. It's absolutely completely reasonable. So give yourself some compassion and some forgiveness if you're feeling like shame, any kind of sense of shame about being anxious or higher depressive rates right now. Give yourself some forgiveness and compassion on that. It's a completely reasonable reaction. You just want to be aware of it so you can get help. So, because there's a lot of people who can be helpful. Increase reaching out to your loved ones with cancer during COVID-19. Some people can be kind of afraid to ask for help or feel like they're a burden. So it's important just to reach out and be chill. Like, you don't have to be stressful. Just relax when you reach out to someone, and just that you're thinking of them. It could just be a text. It doesn't even have to be an in-person thing. So practice healthy coping habits to reduce anxiety and depression, like all the ones that we talked about. Actively engage in social relationships safely with social distancing, phone calls, or virtual platform. That's my opinion. The social relationships, engaging with social relationships, and the finding meaning, like that is my opinion. That is really what helps people get through this situation. And contact a mental health professional if needed. Absolutely. So who to call for help? So the top three, King County 24-hour crisis line and suicide prevention lifeline. The nice thing about the suicide prevention lifeline is they do have a texting option, and teenagers seem to like that. Snohomish County Crisis Line, if you're feeling suicidal or somebody is suicidal, then those are numbers that they can call, or they can go to an emergency department. Cancer Pathways, we have a lot of great support groups where we talk about all this. We have living with cancer groups, parent groups, family groups, caregiver groups. So there's a lot of options there. If you are interested in joining a group, please you feel free to email me directly, because I'm a social worker there, so I'm happy to help you. Uh, check insurance for a mental health provider if you want to see a therapist. Contact your doctor. There's some apps that a lot of people have found particularly helpful for kind of mindfulness or stress management. Calm, Headspace, Insight Timer, Talkspace. So I've had people recommend all of them. I don't have a favorite. I think do whatever works for you, what you connect with to increase calm. So remember, we're managing stress. We're not trying to get it away completely, just managing it. Just references, but most of this really came from Center for Disease Control, National Institute of Health, Journal of Psychosocial Oncology.